Welcome. Hi, I'm Dick Deming. I'm Medical Director of MercyOne Cancer Center and founder of Above and Beyond Cancer. Welcome to our Cancer Education Series, which is supported by a grant from the Iowa Cancer Consortium. And you guys are in for a treat tonight, and so am I, because one of my colleagues is here. This is Kylie Cooper. Hi, Kylie.
Hello.
So Kylie is from Boone, Iowa, and she went to Iowa State, where she majored in kinesiology and community health, and then got her master's in public health at Des Moines University. She's been involved in cancer care for many years with many different organizations, but of note, she was the director of the Integrative Medicine program at the Swedish Cancer Institute in Seattle. And I am so happy to let you guys know that she is now directing the Integrative Medicine program within our cancer center. So welcome.
Thank you. Excited to be here.
So first of all, what was it like coming back to Iowa after living up in the Seattle area for
Cold.
a few years?
It's so cold here. I forgot how
You
cold.
forgot how cold it was in Boone, Iowa.
I did, yes. But it's been great. We have a little one, and realized being out in Seattle 2,000 miles away from our family just wasn't working for us anymore. So decided to make the trip back, and here we are.
Yeah, well, we are so delighted. So Kylie and I had worked together a bit before she went to Seattle.
Mm-hmm.
She had been working for Komen of Iowa, the breast cancer advocacy and support organization, and over the years has also worked for the American Cancer Society. And as we were creating our integrative medicine program at the MercyOne Cancer Center, Kylie moved back, and with the experience she had in Seattle, I said, yeah, let's get together. So Kylie, tell us, what does the term integrative medicine mean?
You know, integrative medicine, I think, means different things to different people depending on what type of program. But I think what we're doing here at Mercy is really, it's supportive healing. It's holistic care for the entire patient, their family, their communities, their own support systems.
Yeah, I like the way you define that. You know, there's this quotation that I often use from Sir William Osler, a physician who said, a good physician treats the disease, a great physician treats the person with the disease. And I think of integrative medicine as part of this healing. We often say not everyone can be cured, but everyone can be healed. And integrative medicine is bringing into the cancer center, you can do integrative medicine with other diseases, but it's bringing into the cancer center modalities of care that are designed to help heal and improve the quality of life for patients and their families.
Absolutely. And, you know, each service might not be for each person, and I think that's what's important about having an array and a suite of services, is that when you are the patient or the family, different things will speak to you. To have them available is just so wonderful.
So we're going to talk about specific services. Just again, the term integrative medicine. Over the years, there have been different terms for these treatments that we do for patients that aren't designed to kill cancer cells, but are designed to help improve quality of life. And we'll get into some of them. They're including nutrition, acupuncture, massage therapy, chiropractic care, music therapy, art therapy. Some of the other terms that have been used over the years are alternative medicine or complementary medicine. We like the term integrative medicine because it's not either or. I mean, when you talk about alternative medicine, it makes you think that you either do this or as an alternative you do that. Really it's both and. There's no reason in the world why we can't be doing integrative medicine techniques in addition to doing the standard way of treating cancer, which includes surgery and radiation and chemotherapy. Maybe for the sake of giving us a little bit of your background, tell us a bit about the integrative medicine program that you had at the Swedish Cancer Institute, and then we're going to segue into what we are creating together here at MercyOne Cancer Center.
Great. Yeah, when I went out to Seattle, I was blown away by the progressiveness that they were approaching integrative medicine with. And I think what's so great about the way that they integrated integrative medicine into the cancer center was that everyone worked as one team. It wasn't siloed. It wasn't a patient seeing a massage therapist in the community who didn't have communication with their docs. Everyone was part of the care team, and everyone was having conversation about that patient. So I look forward to bringing that here.
You're right, because much of what we're going to talk about exists in the community, but patients and their families sort of find it, and then the services that they might get at other providers around the city doesn't ever become incorporated into the medical record, and they often don't have the advantage of all of the background medical information. So to be able to not just provide integrative medicine, but to bring it into the cancer center. So what we have created architecturally is a center that has in the cancer center itself rooms where we will be doing acupuncture, massage therapy, chiropractic treatment, osteopathic manipulation. We'll be bringing in mental health counseling, other forms of touch therapy, as well as art therapy and music therapy, and a variety of meditative and stress reduction techniques into the cancer center, so that patients who are already comfortable in the cancer center, having gone through their cancer treatment, are likely, we think, to feel very comfortable partaking in these services there in the cancer center, and it'll all be part of our medical record.
It's a one-stop shop.
Yeah. So maybe talk about some of the individual practices that you that we're going to be providing, and your experience with those practices in Seattle, and how they have been a benefit to patients and their families as they go through their cancer journey.
Sure. I think the first service that we're really going to focus on getting integrated into the cancer center here is massage. Massage therapy, as you know, is extremely beneficial for patients with lymphedema, pain, but also there's patients who just need to be touched, especially during COVID. Some patients just truly need touch therapy and to feel touch and embrace from someone else. So massage, is not only, good for the pain and the body, but it's good for the soul too. So, out in Seattle, we ended up having a massage therapist on site every single day, 8 to 5, fully booked. And they did also have a practice out in the community, so patients could see them at either place, but the records and everything were shared between, so they were able to really, talk to the surgeon who can say, hey, this patient has XYZ going on, make sure that you're doing something for that. And I think it provides more comfort for the patient also, to know that their doctor is talking to a massage therapist about them.
And there's many studies, so it's an evidence-based practice showing that it improves quality of life, relieves pain, and relieves stress. And there are lots of massage therapists in Des Moines, Iowa, and many very, very, very good ones. The benefit of getting, as a cancer patient, massage therapy at the MercyOne Cancer Center is that we will be having massage therapists who also have a medical background, so have special training in oncology and in medicine, and the patients will know that we as docs are involved in helping design the massage therapy, so that patients who are having medical problems such as pain or lymphedema or even blood clots. Those are conditions that sometimes in the community the massage therapist may be, this is really not something I should be working on, but in a medical setting, with the supervision and collaboration with doctors, you're much likely to get a more focused massage therapy to address the medical concerns. The other huge advantage is that the massage therapy that will happen within the walls of the cancer center is all covered by philanthropy, so patients will not have to pay out of pocket. Right now, massage therapy is not covered by most insurance plans, so if you were to get massage therapy in the community, you'll be paying out of pocket. The way it will work here is that we'll be paying massage therapists, and there will be no out-of-pocket expense to our patients.
Which is so wonderful and goes such a long way for access to care and ensuring that anyone can access a massage. And, this isn't your run-of-the-mill hot stone massage, right? This might be 15 minutes because that's all you can handle. This might be, the only time that a patient is comfortable lying down because they're propped up with pillows and don't have pain for the first time. So, this truly is very different from your, massage with hot stones and relaxation, but it is still relaxing.
And we also plan on providing some short massages to our staff at the cancer center. So not only the doctors and nurses and ancillary support within the outpatient, but also the inpatient. So we think that we all have to take care of ourselves, and having the ability to get a little 10-15 minute chair massage as a provider, I think, will also help spread the word of integrative medicine techniques, and also bring some of our caregivers around the hospital into our outpatient facility where this will be practiced.
Yeah.
What are some of the other integrative techniques that we'll be bringing into the
So the
center?
next one that we're really excited about is mindfulness meditation, or mindfulness-based stress reduction. And we have a lovely person in the community who does this, and so we're looking at bringing her in, and we're kind of exploring a new model with this idea, where she'll be really kind of more on demand, as needed, kind of like a social worker or a patient navigator or the nutritionist, kind of coming to the patient when they're in kind of that most needed hour, to help them decompress, teach them some methods of dealing with stress through mindfulness, and giving them tips and tools to take home. We're also exploring having her do a community mindfulness group, potentially once a month, maybe twice a month, that would be open to any community members, cancer patients, their support systems and caregivers, and just really making this something that not only is there for cancer patients, but also for the community at Broad here in Des Moines, and just teaching this idea of mindfulness.
And Allison Pete has been my guest and has talked about the evidence behind mindfulness-based stress reduction. It's really a type of meditation, if you will. When we use the word meditation, you often think of somebody, in a lotus position, silent, sitting there for hours. Mindfulness-based stress reduction includes some of the techniques of meditation, but doesn't have all of the necessarily Eastern and religious connotations. And there's absolutely no doubt that practicing mindfulness-based techniques improves one's quality of life. In reducing stress, you also will have less pain and sleep better and be more engaged in your life. And so it's not just for cancer patients, it's for anyone. The more that we can all be present in the moment, the better our lives will be. But that is one of the techniques that has a lot of evidence verifying its benefit on your psychological health, but also your physical health. It can help lower blood pressure, improve your cognitive abilities, and improve sleep.
Yep.
Okay?
So I'm also very excited because I have a love for pets. I'm meeting with a pet therapy. His name's Murphy tomorrow.
And what is Murphy?
He's a dog.
Okay,
Yeah.
Murphy's a dog.
He's only dogs.
Yes. So
No ferrets or anything, just dogs. But Murphy, we're looking at having Murphy come to the Cancer Center. And I'm really excited about this because this was something I was never able to do in Seattle because they did transplants, allopathic transplants.
Gosh, so donor transplants
Yes.
with a huge risk and fear of infections, and so trying to be overabundance of caution and
Yeah.
not allowing animals in the center.
Yeah.
So we're going to allow animals,
Yes.
certified, trained
Yes.
animals, dogs.
Dogs.
And, again, there is plenty of evidence showing that interactions with a trained pet, most commonly dogs, and that's what we're going to do, has a huge impact on improving quality of life. So I'm hoping maybe we can even get to the point that we actually have our own dog. So I was chatting with the person who is in charge of the dog at ChildServe. So ChildServe here in Des Moines is a wonderful institution that takes care of children with severe disabilities. And they started off with a pet therapy dog that would visit. Now they actually have full-time employee that is the dog, and he is there all the time.
He's going to live with you.
And so we're not going to start off with that.
No.
We're going to utilize dogs that are certified pet, and their trainers that are certified pet therapists, and bring them into the center.
Yeah.
But who knows? We'll maybe get to the point of
Yeah.
having our own.
It's fun, yeah. I'm also really excited about music therapy and art therapy. These were new to me when I lived in Seattle. I had never even heard of such a thing, and that people were actually credentialed in as counselors in art and music therapy. And I'm really proud of the music therapy program that I started out there, and it was, I think it takes the right person to be in that role. But just a lovely woman who spent time playing her harp and, meeting with the patients, having them develop lyrics to songs, working with them through noise and, banging a drum to release some aggression. But it really is amazing. And I think here in Des Moines we do have music therapists. So we are looking at bringing someone in and actually having one-on-one sessions with patients. But for now, we're wanting to start music as therapy.
Mm-hmm.
And do you want to talk more about that?
Yeah.
Yeah.
So, in fact, you can go to our YouTube channel and listen to a conversation I had a few weeks ago with Bob Schleter, who is a musician. And the concept of music as therapy, any of the creative humanities can have therapeutic value. So, for example, writing, so journaling, poetry, music, art, all of those have the ability to provide healing and improvement in quality of life. And there's two components to those, I think. One is the creating of those, so it can be the creating of music, so it can be as simple as singing, getting together as a group and singing, and I mean the joy and the delight and the healing that can come from that, or producing art, or writing, so the creative process can be healing, but also the observing, so the listening of music, the watching of art, the listening to poetry, those can be healing. So art as therapy, or music as therapy, or poetry as therapy can include both the components of creating either individually or collectively, because then you get, if you're doing, let's say, a group art project, you also get the healing benefit of the collaborative nature of doing something. And, as I said, both the creating and also just the listening and contemplating of art or music or poetry or literature.
Yeah, it connects to the soul, I think. And, you know, I had a patient out there who, right after I started, we were just starting the music therapy program, and he was undergoing radiation for head and neck cancer. And I'll never forget meeting him because he just was so frail and just defeated. You know, he was kind of to the point he just didn't want to do this anymore. And I got talking to him and found out that he used to produce music and ended up connecting him to the music therapist. They developed a song together that he would play every time he went into radiation to help him calm down. As you know, radiation for that is very traumatizing, can be very traumatizing. And I saw him 6 months later and didn't even recognize him. You know, he walked into my office and I was like, "Can I help you?" And he told me his name. I said, "Oh," I mean, just a completely different person. And he said, "She saved my life." She saved my life. Yeah.
And we're going to have these types of interventions, you know, as we talk about music therapy, art therapy, we're also very interested in bringing the community into it. So some of it will be happening in our new space, but we also are interested in collaborating with John Stoddard Cancer Center and doing some things in the community. And in fact, on February 5th, we're going to be sponsoring with John Stoddard Cancer Center and MercyOne Cancer Center and Above and Beyond Cancer, bringing a string quartet from New York City that has written and performs music that is healing. And in the afternoon, the concert will be that evening at Hoyt Sherman, which is just a beautiful, beautiful venue. But in the afternoon at Hoyt Sherman, we'll have a several-hour seminar on music therapy and music as therapy. So look to our website or the Above and Beyond Cancer website to get more details. The afternoon event is totally free and open to the public. The evening event is a concert, and that there are tickets for that, but the cancer centers are also going to be providing some tickets for cancer survivors that want to attend the actual concert. So another example of collaboration. Most of the integrative medicine techniques are in the community. We're bringing some of them directly into the cancer center, but some of the events we'll be doing jointly in the cancer center and out in the community.
Right.
What are some of the other programs that?
Other things that I was, overseeing were nutrition counseling, genetic counseling, physical rehabilitation, and oncophysiatry. A lot of those services are things that Mercy has in-house. So I'm excited to really kind of dive deep into those and figure out, are we collaborating the best we can? Can we increase their oncology footprint maybe? Mm-hmm. And I know you've talked to some people about potentially even coming up into the space.
And the services, again, integrative medicine can include nutrition, what's the right thing to eat, how does that help improve your quality of life and well-being. For some patients that are going through the cancer journey or are through their treatment, they may have lingering physical side effects or of the treatment. So the classic example is a woman who's had lymph nodes removed from under her arm for breast cancer may have lingering lymphedema. And there are physical techniques that occupational therapists, physical therapists, massage therapists can do to help relieve those. So those would all fall into integrative medicine. We will be bringing into the center not only the massage therapists, but also physical therapists, chiropractic physicians and osteopathic physicians that do manipulations. Those are specifically designed for physical side effects that patients may be experiencing that will, and it can be, as I said, pain, it can be scar tissue from surgery or from radiation, it can be lymphedema, it can be range of motion limitation from surgery. So all of those physical touch therapies will be bringing those practitioners into the beautiful space we have within the Cancer Center.
Yeah, and I think also just, reconfirming some work around prehabilitation. And, if we do have a patient who just went through breast surgery and now has limited range of motion, that's going to limit, or that's going to move out their treatment if they can't get their arm in the right position. So focusing on that prehabilitation to make sure that they've got their range of motion and they don't need to delay care further.
And we actually are participating with the National Cancer Institute in a clinical trial looking at prehabilitation for patients that have limited physical activity and pulmonary function and need a big surgery. So rather than, well, your risks are just greater, well, we're going to do the surgery and the recovery is going to be difficult, you actually focus on doing prehabilitation, so physical conditioning before the surgery to reduce the risks of the surgery. So we're already doing that through a grant and a clinical trial with the National Cancer Institute, but to actually have those practitioners in the clinic will make it even more convenient and more patient-centered for the patients.
Right, yeah. I think just being able to see your providers in one space as a patient just further decreases anxiety, knowing that they're all talking to each other.
And another integrative medicine technique is mental health counseling. Mm-hmm. So we will be bringing that into the Cancer Center so that you don't have to go elsewhere for that. When you look at the issues that cancer patients have, some of the issues are the cancer itself, but surprisingly, many patients don't have a lot of symptoms from their cancer and actually have more symptoms related to the cancer treatment than to the cancer. And you add in not only the physical symptoms, but then the stress and anxiety of facing a potentially lethal disease, while at the same time you're trying to get on with life and do all of the other things that are important. There is a time where medications can be helpful, but even more helpful in my mind is learning how to philosophically approach the difficulties that you're facing, and with counseling and cognitive behavior techniques, learn how to, in a healthy way, deal with the stress and anxiety that comes with going through a difficult procedure.
Absolutely.
And so many times we get so focused on the killing of the cancer cells that we lose sight of the fact that this is a human being with emotional, psychological, philosophical, and spiritual issues, and that if we only focus on the killing of cancer cells, we're missing the opportunity to heal and to provide a lot of support for patients.
Yeah, I don't remember who said it, but we need to focus on the healthy cells. There's a lot more healthy cells to focus on than the bad ones.
Yeah. You know, we have a large live studio audience tonight, so let's open it up to some questions. Yes.
I have one. It's interesting. I've got to meet other patients because I'm going through radiation treatment, and we all were talking about the types of, all the types of chemotherapy medicine that we're given, and we all like, did you get nosebleeds? Yeah, I did too. I mean, it was stuff that we didn't share with our caregivers because they wouldn't understand. We understood. So are you giving opportunities to do like group sessions
Yes, yes.
with a virtual or
Support
at the
groups.
center? Yes.
And support groups, not just support groups for patients, but also support groups for caregivers. And by caregivers, I mean your caregivers, your family, friends that are part of the journey with you. Yes.
It's extremely important.
Yep. And our new facility, again, form helps with function. We've got beautiful spaces to accommodate that.
How would we handle exercise for cancer patients?
Yeah, physical activity is huge. So we're not going to build a gym as lovely as this facility that we're in. That would be not a good use of resources. So as you know, our cancer survivorship program, in collaboration with Above and Beyond Cancer, has over 18 activities that happen, everything from spin class, which I'll be doing tonight, to pole walking, to outdoor hiking, to cross training, to yoga, Pilates, Tai Chi. So those activities will happen. What we do envision happening is in our facility, we've got a large room that we'll use for demonstrations. So for folks in the cancer center, we'll do some of those activities, but we'll still be doing a lot of that physical conditioning out in the community at the YMCA, at the Mercy Health and Fitness Center, at Greenwood Park, and at Jester Park, and at various places. So the opportunity will be to bring some of that activity into the Cancer Center, mostly as a demonstration to get people comfortable and excited about the programs that we're already doing in the community.
I'm speaking Tai Chi. I just started the Tai Chi, the virtual, and it's awesome. I mean, it's for beginners, so she's going through it really slow, so that you can catch on, and then we're going to pick it up a little bit, but it's really great because then you're in that comfort zone. Unfortunately, I have cats that want to join me in the virtual, and I'm doing the Tai Chi with the cat holding my hand. I'm going, got to do what I got to do, because I used to teach virtual as a teacher. So they're thinking the kids are going to show up any time, so they keep photobombing, and the instructor's like, got another cat here, But it's fun because
That's
it's
fun.
like you build a community, even though it's virtual.
Yeah, that's good to hear.
You're complimenting and laughing. And
Yeah. I was
learning.
so impressed and blown away when I saw everything Above and Beyond is doing. A lot of that work was the work that I was doing in Seattle, was coordinating all those sorts of activities in the community for all 5 of the cancer center sites. Because most people, they do not want to drive back to Seattle in the evening. That's just not going to happen. So taking it out to the community was extremely important. But one of the things that we did that was a lot of fun was hula.
Hula.
Hula, yeah.
Okay.
And it just, people, it was like a laughter, laughter therapy. And we even talked about laughter therapy, laughter as therapy. But
And you mentioned Tai Chi. So Tai Chi, again, evidence-based. It's very good at improving balance and preventing falls. So you'll see many fitness centers, including the YMCA and the Mercy Health and Fitness, have Tai Chi and really promote it for seniors. As we get older, our balance gets worse. Everybody gets a little bit of degree of peripheral neuropathy, and the Tai Chi is one of those interventions that has been proven to help improve balance and reduce falls. Comments or questions? Services that you would like to see?
yeah.
Yes.
I have a question about the music programs and stuff. It seems like it can be so. You can have several facets of the music. You can have it as you listen to it, or perhaps you can be have an instrument that you can play singly or solo, or even playing as a group. I'm just wondering, when you take that all into effect, what is the best type of music that you would want to have? Do you want something that's mellow, or do you want something kind of upbeat and get you going? Or
What speaks to you?
so
Right?
that's the answer.
Yeah,
Yeah.
but there is so the National Cancer Institute actually has studied this, and there are different types of music that can serve different purposes. So for example, I think about, if I want to use a little bit of music to prepare me for sleep, that is a very different music than if I want something to pump me up and pedal faster in spin class. It really is different. Music can serve different purposes, bringing sort of a happy, optimistic look at things versus let's reduce the stress versus, I need to just contemplate some deep thoughts right now, and what type of music might help facilitate contemplation. So those are different. But as you also mentioned, there's the playing of music. So there's also evidence-based programs of collective drumming. And some of this is based on work, studies looking at, for example, marching together in military, that synchronized physical activity to a beat does something that changes even our chemistry. So there are many different ways of incorporating rhythm, music, and doing things in sync with other people that have been proven to provide benefit in terms of stress reduction and sense of well-being.
I saw an article about where they brought music into correctional system, and to be able to have a band or an orchestra, to be able to get together, and then they're finding that this has really been beneficial as far as being able to do the correctional thing, to be able to get these people so that they can be back out in society. Is this something that you're seeing also? Is that this can really help in the patients?
Let me answer that in an even bigger way. So at Creighton University School of Medicine, they've totally revamped the curriculum and brought humanities into the education of physicians. So the big picture is that a doctor taking care of a patient is a human being taking care of another human being. That is the essence of humanity. And so bringing in those things that we call humanities, art, literature, poetry, music, philosophy, religion, those have a healing benefit. And we're learning more and more with doing, for example, MRI scans of the brain of people who meditate, and learn that, so for example, if you wanted to have a bigger bicep, I could give you a 8-week program that includes biceps curls. If we measured your biceps before you started that 8-week program and after, no one would be surprised that you would have an objective increase in the size of your biceps. We all understand that it happened. If you want to change the way your brain looks, you can do a brain MRI before you begin an 8-week course of meditation, and do an MRI, and you can see objective changes in the size of certain parts of your brain. This is called neuroplasticity. Nobody's surprised about myoplasticity, about making your muscles bigger. That doesn't surprise anybody. We know we can do that. You can actually change the physical dimensions of your brain by doing certain activities. And I just mention that because who would have thought that meditation might change the dimensions of my brain? And all of the humanity techniques, this idea that mind and body are separate, they're not separate. Some of it is anatomy, some of it is physiology, some of it is chemistry. But how does something that happens outside my body change my body? If you you take the garbage out at night and a dog jumps out of the bushes and barks at you but doesn't touch you, you can feel the physiology that happens. I mean, your heart beats, your mouth gets dry. That is tons of many, many physiologic things that are happening, and nothing touched you. Nothing from out there came inside you, but you could see what happens. The same thing happens when you listen to music, when you are enjoying a conversation. Nothing is coming inside you from out there, but what happens out there through the brain-body connection has various chemicals released that make physiologic changes that provide these sensations. The negative ones tend to be like in your face, and you recognize it within a minute or a second what's happening. The ones that are more beneficial take a little bit longer for you to realize this physiology that's taking place in your body. So how the humanities affects us, we're learning the how, but there is no doubt that it does, and evidence has been derived from many studies showing the benefit this has. I'm reluctant to go so far as to say that these techniques are going to kill cancer cells and affect the overall cure rate. Some of them may have the power to do that, but there's no doubt that they provide healing and well-being and improvement in quality of life, and not just for the patient. The other thing that I meant to say at the beginning is that these techniques are for anyone, regardless of where they are in the journey, just been diagnosed, in the middle of going through treatment, done with treatment and having been cured, or on a journey with incurable cancer. And they're not just for the cancer patient, they're for the family as well. So the truly holistic approach is not only to take care of the entire person that's the patient, but the entire family. And so we feel really strongly that many of these integrative techniques will be open to the caregivers as well. And the plan is to provide these services that aren't reimbursed by insurance through philanthropy.
Our
Right now, through the treatment that I'm going through, one thing I noted in the other patients is we love the music being played, because the sound of those beams clicking, and for some reason for the last couple of days they haven't been playing music, and I've been noting that. So I don't know if somebody complained, because it's like the 70s and 80s music, which is I love that genre. And I kept hinting. I said I really do miss the music. And I find myself getting really tense because there's no music, because it escapes you from what's going around on you, even though they've got this laser and all that, and they're saying you're tensing up, and I'm hinting yes, because there's no music.
Yeah, I'm so glad you brought that up, because there's also, as you pointed out, not everyone likes country, not everybody likes rock and roll, everybody likes everything. So how can the technology certainly exists where, you press a button, it's you, and you've already selected your playlist.
Yeah.
And we need to be aware of that. And your playlist on one day may be different than on another day. I mean, sometimes you want Tina Turner, and some days you're just hankering for a little bit of Johnny Cash, or a string quartet.
Right.
Comments or questions? Yes.
I have another question. Kylie, with your nutrition person, will it be classes or will you have individuals sessions with patients who
Yeah.
would like that?
So there are 2 nutritionists that work with the Cancer Center currently, and they see patients kind of on an as-needed basis. They're able to help with things like I can't taste anything, I can't swallow, things like that. But absolutely, it's something that we've talked about to further, provide information out to the community is classes, maybe online demonstrations, maybe these are the ingredients you need.
And cooking classes.
Cooking classes.
Right here at the Mercy Health and Fitness Center, we have this demonstration kitchen. So it will involve not only, what are the foods that are incorporated in a healthy diet, but hey, how about let's cook of some foods that include herbs that may be of benefit. So I'm a big believer, rather than going out and buying a bunch of things in capsules, herbs that have been ground and put in capsules for you to take like a pill, let's look at recipes that incorporate healthy herbs and foods into recipes and also have some fun and some fellowship that is healing in the process. So we do have the opportunity not just to do one-on-one counseling on what you should eat, but let's do some collective team building, supportive activities that actually create recipes and create some food to actually consume. Other questions or comments?
We were talking earlier about the humanities and the various different arts and types of modalities, right? And it reminded me that, I'm excited about not only getting these programs, up and going with you, but also, seeing how they evolve and what's needed next. One of the things that we ended up developing out there was an art therapy program for children. And it was, a 6-week in the evening course that kids who had parents going through treatment would come to, and they would explore their feelings through art with the art therapist. So there's just so many different avenues to kind of go down and figure out, what is the need here. And I'm excited to figure out what that need is.
And as we're creating all of the programs, we also have a patient advisory council. So if any of you would like to serve on that, we want to get feedback. We want to develop programs that are relevant and meaningful. And we will be growing and expanding as, the opportunity comes along. So I want to thank you all for being here tonight. Thanks for being part of this, and please help us as we create something that will help improve your health and well-being. Thanks everyone for joining us tonight. Please come and join again next week. If you know someone who would benefit from hearing us, this has been recorded tonight and will be a video podcast that you can find by going to the MercyOne Cancer Center website or the Above and Beyond Cancer YouTube channel. We hope to see you next week. Thanks everybody.